Oh, hello there. Welcome in. Hi. It's nice to see you. Do you have an appointment today? Let me see. What's your last name? Ah, yes, okay. I see. So, and your date of birth? Excellent. You are here to get a general checkup and cranial nerve exam, correct? Excellent. Well, before we get started, I just have a few simple questions for you. First, do you need to use the restroom? Or get yourself a cup of water, perhaps? For sure. Yeah. Anything that you need to get done, before you sit down, this is going to be somewhat of a lengthy process, so yeah, feel free to get situated. Are you currently on any medications? Okay, and how much sleep would you say you get every night? What would you say is the average time that you go to sleep? And what time do you normally wake up? What time do you have your alarm set in the morning? Now, do you always wake up at that time? A little bit before? Maybe you snooze a little bit? Yeah, okay. So, and before you go to bed each night, are you usually reading a book, watching TV, looking at your phone? What do you usually do before you go to bed? Okay, for sure. Do you have any type of, I guess, nighttime routine that you kind of stick to? Okay. Yeah, no, definitely. I have a little nighttime routine. I usually just have some tea, I read, and then I just kind of go to bed. So, it's good. Yeah, my brain usually knows when I get out the tea that it's kind of time to start winding down. It's good for you, yeah. And are there any other concerns for today that you kind of want to let me know of so I can pay attention to that as I'm going through the exam? Okay, I will take that into consideration. Very good. Now, I'm going to start us off with just some deep breaths. I'm going to listen to your heart, okay? Okay, I'm just going to have you take a nice deep breath in and exhale. Okay, and inhale. And exhale. Very good. Okay, another one. And exhale. Good. I'm going to put one on your back here on this side. Go ahead and inhale for me. And exhale. Okay, very good. And I'm going to go on this side on your back, okay? So go ahead and inhale for me. Nice deep breath. And exhale. Very good. Okay, very good. Everything sounds great. It felt alright when you were breathing in. Very good. Okay. Excellent. So, if everything is alright there, I will start out with an eye exam. These gloves are a little bit big, but they get the job done. Okay. So, do you wear contacts or glasses? Both? Neither? And are you wearing contacts right now? Okay, perfect. So, we will be able to test your naked eye then. That's perfect. So, I'm just going to start by looking at your eye. If you could just look at me, and I'm just going to take a peek at your eye, okay? Well, both eyes, but you know. Very good. Oh, sounds like it might be raining. Just a little sprinkle. Did you perhaps bring an umbrella? Just in case it's still raining by the time our appointment is over. Well, if you need one, there's some out in the lobby for you. Yeah, just bring it back the next time you're here. No worries. Okay, can you go ahead and look here for me? Okay, and look here. Can you look right here? And right here. And right here. Can you look right here? Very good. And right here. Okay, excellent. Now, I'm going to have you follow the light very slowly. Sounds like we're getting quite a storm here. I love the rain. In fact, I've been looking forward to it returning. It makes me want to curl up with a nice cozy book. Just keep following the light. You can blink as normal. Very good. I listen to rain sounds every night before bed. I put them on the TV and I just let it play and I fall asleep to it. I love it. Can you blink and look at me? Blink and look at me again. Great. Now, I'm just going to have you look up, but with your eyes, not your head. Okay? Go ahead and look up for me. Okay, and can you blink and look at me? Very good. Now look down. Very good. You're doing great. And blink and look at me. And can you look that way? Very good. Very good. Keep looking that way. Okay, and blink and look at me. Blink and look at me again. Okay, and look that way. Very good. Excellent. Excellent. Keep looking. Okay, now if you could just blink, look at me, and now close your eyes, close your eyes, close your eyes. Okay, keep your eyes closed. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and open your eyes. Very good. Okay. So, now can you look straight at me and tell me how many fingers I'm holding up on either side, okay? Ready? Good. Okay. Very good. Excellent. Very good. Now I'm going to just move your head a tiny bit so that you are facing this right here. Sound good? Okay. So I'm going to have you look there, and I want you to tell me, can you read this line for me? Can you read line 5? Line 5 for me. Okay, how about line 6? Can you read line 6 for me? Okay, now I'm going to have you look just with your right eye, okay? Can you tell me what's the lowest line you can read? Okay, and how about with your left eye, what's the lowest that you can read? Very good, okay. Marvelous. You did very, very well. Good work. Okay, Now, I'm going to do a face exam on you, okay? Okay, if you could open up your eyes as wide as you can. Okay, can you bring your eyebrows all the way up? Very good. And now can you scrunch them down? Very good. Okay. Can you, let's see. Can you give me a big smile? And can you give me a frown? Can you give me a smile with your teeth? Very good. Can you open up your mouth as wide as you can? Perfect. And can you stick your tongue as far as you can? Now can you move your tongue in a clockwise motion? Can you do counterclockwise now? Excellent job. Very good. Okay, I'm going to be touching stretches easily. just take a look in your mouth. How are you with dental hygiene? You keeping up with it? Are you trying your best? What's going on there? No judgment. Okay. Okay, sounds good. So, in that case, I'm going to just take a quick look. How often do you see a dentist? Every 6 months or so. That is totally normal. So, my light doesn't seem to want to work. That's okay, I've got backup. So, I'm going to just have you say ah. Okay, very good. And did you ever have braces or Invisalign or anything? Okay. Did you have any oral surgery at all when you were either an adult or a child? Wisdom teeth removal or anything like that? Okay. Have you ever had any type of root canal or skin graft or anything like that? Okay. Yeah, just trying to keep it all in mind. Okay, can you stick out your tongue and say ah? Okay, very good. So I'm just going to scrape a tiny bit of plaque off your teeth. Okay. So, if you don't mind, I'm just going to kind of go in there with the light and the mirror and this and just kind of scrape a little bit. Okay. None of this hurts or anything, correct? You just let me know if it does, okay? Okay, very good. Just want to make sure that this is as comfortable for you as possible. Okay. Very good. You're all set with that. Your teeth actually look really, really good. So you're doing a very good job of taking care of them. Keep doing what you're doing. Do you have coffee or dark tea at all throughout your day? Okay, understood. Okay, now I've got something intriguing. I'm going to do a smell test for you, okay? This one should also be fairly easy. Okay, here you go. What does that one smell like? Just gonna toss these. Okay. So, yes, that one was lemon, so another citrusy one. And, okay, so lemon. So, you did really, really well. Great job. Let's see. Okay, so we have done your eye exam, we have done your face exam, okay? We checked out your ears, which are feeling much better now, I hope. Okay, good. Okay, we looked at your dental health, easy peasy, easy peasy. And then we just did a smell test, okay? And you did really, really well on your smell test. How do you feel about it? Okay, perfect. So now I'm going to start looking at your movements and reflexes, okay? Alright, we just need to get my... Here we go. Okay, first, before we do the reflexes, I'm going to have you do a series of movements with your arms, okay? So, first, I'm going to have you shrug your shoulders all the way up. Okay, now can you relax them? Now can you move your shoulders in a circle going backwards? Good. Okay, can you do it going forwards now? Do you have any sort of pain when you do that? Okay. Now you can just relax them, let them fall, and bring your arms out to your sides. Now what I'm going to do is I'm going to push down on your arm, okay? And you just have to keep it as straight as you possibly can. Don't let me push it down, okay? I'm going to do it on both of your arms and then individually, okay? See if your balance is better on one side than the other, which is usually the case. So if it happens, it's totally normal, okay? Alright, so here we strong, hopefully. And everything looks good there. Okay. Excellent. Now, the last thing I want to do is just clean your eye a little bit. And I'm going to use a Q-tip to do it. So first I want to put a special solution in your eyes, okay? And then once that is totally soaked in, I will then take the Q-tip and just clean your eyes a little bit, okay? Okay, ready? Okay, ready? I'm going to do 3 drops into each eye, okay? Here we go. 1, 2, 3. Okay, go ahead and blink. Okay, very good. And 1, 2, 3. Okay. Now, what I'm going to do is hold your eyelids down. Just keep them closed for a second. Just keep your eyes closed. Very good. Okay. I'm just gonna let that solution soak in. Very good. Okay, and now you may open up your eyes. Okay, now I have this Q-tip, and I'm going to use it to just clean your eyes a little bit, okay? This is not painful at all. I've actually heard it's quite relaxing. And people say